Today, we're going to talk about some rare diseases that you may have never heard of before. These conditions affect a small percentage of the population, and they can be quite difficult to diagnose and manage. Before we get right in, don't forget to hit that thumbs up button, subscribe to our channel, and turn on post notifications so you never miss a new video from us. Cold urticaria. First up, let's talk about cold urticaria. It's a rare but fascinating condition that affects the skin when exposed to cold temperatures. This condition is an allergic response to the cold, and it can cause hives, itching, and swelling. So, what happens in your body when you have cold urticaria? Well, the immune system reacts to the cold by releasing histamine, a chemical that causes inflammation and itching. This reaction can occur within minutes of exposure to cold temperatures, and the symptoms can last for several hours. But what causes cold urticaria in the first place? While the exact cause is unknown, researchers believe that it may be due to an inherited genetic mutation that affects the body's ability to regulate the immune response to cold temperatures. Additionally, some cases of cold urticaria are secondary to an underlying condition such as hepatitis B or C or cryoglobulinemia. Treatment options for cold urticaria include avoiding cold temperatures as much as possible, taking antihistamines to reduce symptoms, and carrying an epinephrine autoinjector in case of a severe allergic reaction. Number 1. Fibrodysplasia ossificans. Next on our list is Fibrodysplasia ossificans progressiva, or FOP for short. This condition affects only around 800 people worldwide, and it's characterized by the gradual transformation of muscles, tendons, and ligaments into bone. Imagine waking up one day and feeling your muscles and joints stiffening, eventually leading to the loss of mobility and the ability to move. This is the reality for those living with FOP. The extra bone that forms as a result of the disease can grow in unexpected places, such as the neck, back, or hips, leading to deformities and severe pain. Sadly, there is currently no cure for FOP. Treatment options are limited to managing the symptoms and preventing flare-ups. This can include physical therapy, pain management, and surgery to remove excess bone growth. So, what causes FOP? It's caused by a mutation in a specific gene that regulates bone development. This gene mutation causes the body to create bone in areas where it shouldn't, leading to the progressive loss of mobility and function. Number 2. Harlequin ichthyosis. Moving on, let's talk about harlequin ichthyosis, a rare genetic disorder that affects the skin of newborn babies. This condition causes the skin to become extremely thick and scaly, making it difficult for the baby to move, breathe, and feed properly. Sadly, many infants born with harlequin ichthyosis do not survive beyond the first few weeks of life. The condition gets its name from the diamond-shaped scales that form on the skin, giving it a distinct harlequin appearance. These scales are thick and hard, and they can crack and bleed, leaving the baby vulnerable to infections and dehydration. Harlequin ichthyosis is caused by a mutation in a specific gene that affects the skin's ability to form a protective barrier. This mutation leads to the overproduction of skin cells and the buildup of keratin, resulting in the thick, scaly skin characteristic of the condition. Number 3. Epidermodysplasia verruciformis. Another rare disease is epidermodysplasia verruciformis, which causes wart-like growths on the skin. These growths can be quite disfiguring, and they also increase the risk of developing skin cancer. Epidermodysplasia verruciformis is caused by a genetic mutation that affects the body's ability to fight off certain types of human papillomavirus, HPV, infections. These HPV infections can cause the skin to develop wart-like growths that can be difficult to remove and often return even after treatment. People with this condition may have hundreds or even thousands of these growths all over their bodies, making it difficult for them to lead a normal life. In addition, These growths can lead to an increased risk of developing skin cancer, which can be life-threatening if not caught early. Number 4. Progeria. Up next is progeria, a genetic condition that causes children to age rapidly. Unfortunately, children with progeria typically have a shorter lifespan than the average person and are at a higher risk of developing heart disease and stroke. Progeria is caused by a genetic mutation that affects the body's ability to produce a protein called lamin A. Without enough lamin A, the body's cells can become unstable and more prone to damage, leading to the premature aging seen in children with progeria. There is no cure for progeria. There are treatments available that can help manage the symptoms of the disease. For example, some children with progeria take medications to manage their cholesterol levels, which can help reduce their risk of developing heart disease. A clinical trial conducted in 2020 found that a drug called Zokinvy can help improve the lifespan and quality of life of children with progeria. However, research is still ongoing. Number 5. Kuru. Let's dive into another rare disease that you might not have heard of before, Kuru. This neurological disorder is caused by eating contaminated human brain tissue and is incredibly rare. It mostly affects people in Papua New Guinea and has had devastating effects on some communities. It might seem like something out of a horror movie, but Kuru is a real disease that has affected real people. While it's not something that most of us will ever have to worry about, it's important to raise awareness about these rare conditions and the impact they can have on people's lives. Number 6. Trimethylaminuria. Another rare disease that we should discuss is trimethylaminuria, also known as fish odor syndrome. This condition causes a strong fishy smell to come from the body, which can be really embarrassing and isolating for those who suffer from it. It's caused by the body's inability to break down a certain compound, which leads to the buildup of trimethylamine in the body. This compound has a strong fishy smell that is released through sweat, urine, and breath. Although there is no cure for this condition, there are ways to manage the symptoms. People with trimethylaminuria can make dietary changes, take supplements, and use certain hygiene practices to reduce the odor. Number 7. Wonderland syndrome. Let's wrap up our discussion of rare diseases with Alice in Wonderland syndrome. This is a neurological condition that can cause some pretty trippy perceptual distortions. People with this condition may see objects as much larger or smaller than they actually are, or they may feel like their body parts are growing or shrinking. This condition is named after the famous Lewis Carroll book because some of the descriptions in the book are similar to what people with the syndrome experience. While the exact cause of the condition is not yet known, it is believed to be related to changes in the way the brain processes sensory information. While the distortions may seem fascinating, they can be really disruptive to people's daily lives. People with Alice in Wonderland syndrome may experience difficulty with reading, driving, and other activities that require accurate perception. Although there is no cure, there are treatments that can help manage the symptoms and improve quality of life for those with the condition. These are just a few examples of the many rare diseases that exist in the world. While they may be challenging to manage and live with, it's important to remember that those who have these conditions are still valuable members of our society and deserve our compassion and support. Let us know if you have any comment by dropping them in the comments section. Thanks for watching, and I'll see you in the next video.